Food, glorious food. But just how much is too much? An annual Ministry of Health survey found 1 in 9 children in New Zealand aged 2 to 14 are obese. In the face of damning statistics, Southern DHB will establish a steering group to refer at-risk children to relevant health professionals. It's a priority set in their recently released annual plan for 2017.
Working with the local authorities about urban design and development to ensure and encourage active living, which of course keeps people healthier and keeps people less susceptible to those sorts of issues.
Southern DHB Interim CEO Chris Fleming says the cost of obesity weighs heavily on the public health system.
In terms of the increasing the prevalence of some of the chronic conditions like diabetes, cardiovascular disease, they are all huge burdens, and so it's in the best interest of working with people who are susceptible of obesity to reduce the impact.
He says when it comes to chronic conditions, the healthcare system has become a victim of its own success.
The ophthalmology problem has been created because we've had advances in the practice that are keeping people's sight good for longer, and we haven't responded actively and quick enough to modifying the health system to cope with the demand.
The government implemented new health checks this year, including the Before School program, which it says will see 95% of obese children referred for clinical assessment and intervention by December. The Southern DHB annual plan forecasts a $22 million deficit for the 2016-2017 financial year. Roselle LeBone, The South Today.